can EAB tests be used for future reactivity to dental or joint implants if there hasn't been any exposure? So example, a doctor recommends titanium dental implants or patients for breast implants. Can EAB tell if they may cause reactivity in the future?
Very good question, and there's a complicated answer. So the answer is the following. If you do the LRA by ELISA ACT test, and you are testing a healthy person, which means someone who will have very few, if any, reactions out of the hundreds of tests we do. A person who is healthy in regard to their immune defense and repair system, a person whose immune system is tolerant, has very, very low risk of implants, silicone implants, or titanium. Now, you raise the question correctly. Until the body sees a foreign substance, it may not react against it. But if the body is in a reactive and stressed mode and exposed to something different, it might react against it. So I've seen hundreds and hundreds of people who had silicone implants or titanium posts put in for dental procedures who ended up suffering because they were not tolerant when the procedure was done. They had delayed allergies to foods and chemicals and medicines that were easily detectable, but they hadn't been exposed yet to the titanium. And when the implant was put in, when the silicone breast implant was put in, their body started to recognize the foreign materials as foreign. And then over weeks to months, the LRA test will become positive. So if you look at the subgroup of people who's never been exposed to titanium, they should have no reactions on the LRA by ELISA ACT. But unless the test is more, quote, psychic and intuitive than I think it is, anticipating the future is even harder than accurately measuring the history and the past. So what I can say is this: healthy people are tolerant, and they don't lose their tolerance just because of an implant. But people who are reactive before the implant are the ones who are at higher risk. Many colleagues, many dental colleagues have stopped entirely doing titanium implants because there are too many complications, both infectious and immune, which are two aspects of the same complication. And they now do ceramics. And in Scandinavia, they're on the 8th generation of ceramics, where they actually somehow have little tiny canals, canaliculi, put into the ceramic, and then they allow collagen, a natural protein of the body, to line those little channels, and they claim that this 8th generation ceramic material is better even than the previous generation. So my view is, if you have to have an implant, be as tolerant and immune balanced as possible before the procedure so that you can heal and heal without developing new hypersensitivities. And on the other hand, if you already have some delayed allergies because you've lost tolerance, I would suggest doing the LRA program for 3 to 6 months so that you can restore tolerance in the immune system before having any elective surgical procedure.